Officials keep a close eye on the COVID-19 trends. It turns out the results from your at-home COVID-19 tests are not included in the state's official data. And health experts say they don't need you to report your positive test either. Dana Smith got answers on how this affects the state's response.
It's a convenient way to find out whether you've been exposed to the virus. But it turns out at-home testing is not included in the Virginia Department of Health's daily COVID-19 updates.
It does not get reported into the state reporting portal, the at-home tests.
And the department doesn't even need that data, according to COVID testing co-lead Susie Trotter.
As far as reporting a positive, just to report it, we do not need that at the state level. The healthcare provider doesn't need that either.
This means potentially thousands of tests are going unreported. But Trotter explained, although at-home test results are not included in VDH's daily case counts, that's not affecting the department's response to the pandemic. She said health experts are analyzing the trends from PCR and antigen tests given at testing sites and reported by testing labs. And from that information, she said they are able to get a clear picture of how COVID is affecting communities across the Commonwealth.
By not having those at-home tests doesn't necessarily change our strategy. We understand where the disease prevalence is. We're still at a high rate of transmission, still at a high rate of percent positivity. So even without the at-home tests, we have a good idea of the needs that will direct us.
Trotter said VDH has enough data to show community spread and hospitalizations are still high. The department doesn't need data from your at-home tests to tell them that. Dana Smith, 13 News Now.
Trotter said PCR tests are the gold standard, and that's what the health department recommends. But given the demand for tests, Trotter said the best test is whichever one you can find.